Typically, phase 1 trials are geared towards investigating toxicity. So we did find synergism or additivity at the very least in the toxicity. We saw a grade 3/4 adverse event rate of over 50%. I'd like to emphasize that a lot of those adverse events were lab values, so elevated lipase, elevated amylase. They were reported separately and counted twice, even though they're in fact the same toxicity in many occasions. The same with elevation in ALT and AST. We found that if you treat the toxicities early with immune suppressants, mostly prednisone or solumedrol, but stronger immune suppressants were occasionally needed, particularly for LFT abnormalities, in which we sometimes use mycophenolate, or diarrhea, for which we use Remicade. But we found that most of the toxicities were indeed reversible. The endocrinopathies tended not to be reversible. With meticulous communication with our patients and open doors and early intervention when toxicities were seen, we were able to control the toxicities in the majority of the patients. And particularly the patients that were treated early on in the trial, a lot of them came off study for toxicity because at the time we were really nervous. Most of those who responded remain in response now years later. They've gone back to living their lives, doing their thing, and they come into clinic every 12 weeks for staging scans.